stop. Before you book your next routine screening, I need you to hear what happened to a 73-year-old man who walked into his doctor's office feeling better than he had in years. He had no symptoms, no complaints, he felt well. The test didn't save him. The test ended him. There are 5 medical checkups that doctors order every single day for patients over 65. Tests considered completely standard, completely routine, completely safe, that the research now shows can trigger a chain of events that ends your independence, destroys your quality of life, or costs you your life, not the disease, the test. And nobody in that exam room is going to warn you before you agree to it. And before this video ends, I am going to give you something I call the 5-second shield. A single question, 5 seconds to ask, that puts you back in control of every medical decision for the rest of your life. I will give you half of it right now and the other half at the end because both halves matter. And the second one changes everything. Here is the first half. If this test finds something, hold that. We will finish it together before this video is done. My name is Dr. Clifford Adeshina. For over 2 decades, I have dedicated my life to one mission: giving adults over 60 the health information they deserve to have but rarely receive. Not because doctors are hiding it, not because the system is corrupt, but because a 15-minute appointment was never designed to cover everything that matters. This channel exists to fill that gap with honest information, with real research, with the kind of clarity that puts you in control of your own health. This is not a channel for generic advice. This is a channel for the truth that changes how you live. And it starts right now. If you are over 65 and you see a doctor at least once a year, what I am about to share could be the most important 15 minutes of medical information you have ever received. Subscribe to this channel right now and turn on notifications, because every week I bring you the kind of honest, research-based truth that a routine appointment was never designed to give you. The people in this community are not passive patients. They are informed ones. Join them. Before I walk you through the 5 checkups, you need one number, because without it, what I am about to say might sound like opinion. It is not opinion. Studies estimate that in adults over 75, up to 1 in 3 routine screening findings leads to treatment that offers no survival benefit whatsoever. Only side effects, procedural risk, and a body that now has to recover from something it never needed to go through. 1 in 3, published in peer-reviewed literature. Not a fringe claim, not a conspiracy. A documented pattern that the medical system has not yet built a reliable way to discuss with you in a 15-minute appointment. Here is why this happens. After 65, your body changes in ways that completely rewrite the mathematics of screening medicine. Modern imaging technology is extraordinarily sensitive. It finds things, but sensitivity cuts both ways. Across the more sensitive the instrument, the more it detects things that were never meant to be found. Conditions that have been quietly present for decades, causing no harm, asking for nothing, that would have accompanied you peacefully to the end of a long life. The clinical term for this is overdiagnosis. And once a diagnosis exists on paper, the clinical machine does not pause to ask whether this finding in this body, at this age, will ever actually become a problem. It moves forward. Referral, biopsy, procedure, complication. That is not a flaw in the system. That is the system working exactly as it was designed. For the wrong patient, at the wrong time. I want you to picture a family photograph. You know every face in it. You know the story behind every expression, every gray hair, every line around the eyes. You know which ones speak of hardship and which ones speak of laughter. Now imagine handing that photograph to a facial recognition scanner programmed to flag every deviation from a 25-year-old face. It will flag everything, every line, every shadow, every mark of a life fully lived. Not because anything is wrong, because the machine was not built to understand what a life looks like from the inside. That is what happens when a screening system built for younger bodies meets the biology of someone over 65. The instrument is exquisitely calibrated, but it was not calibrated for you. The study published in the British Medical Journal found that in certain cancer screenings in older adults, the majority of detected cases may never have caused symptoms or shortened life. The majority. And here is the part that should stop you cold. Every one of those majority cases still triggered the same clinical response, the same machinery, the same cascade that turned Emmanuel, a 73-year-old retired engineer who was walking 2 miles every morning and tending a garden on weekends. From a man who reported feeling better than he had in years into a man recovering from a surgery he never needed, with his walks gone and his garden untended. Not because of a disease, because of a test. Remember his name as we go through these 5, because Emmanuel's story does not end there. Emmanuel came in for a routine annual physical. No symptoms, no complaints, blood pressure managed, cholesterol decent. By every clinical measure, He was doing what most people his age had long stopped doing. His doctor, a good doctor, a careful doctor, looked at his chart and noted several routine screenings were overdue. Emmanuel was not alarmed. Why would he be? He felt fine. This was just maintenance. The responsible thing. That moment, I feel fine, this is just routine, is the exact moment I need you to think about. Because that is where every story I am about to tell you begins. In a waiting room, in a paper gown, in a moment of complete confidence that nothing bad is coming. The Emmanuel screenings found something. That something triggered a follow-up. The follow-up led to a procedure. The procedure caused a complication. 4 months after the appointment, where he said he felt better than he had in years. Emmanuel was in recovery. His independence, built and protected across 7 decades of living, was gone. Not taken by a disease, taken by a test. I am going to tell you which test started it. But first, let me take you through all 5. Cause what happened to Emmanuel could happen to anyone in that waiting room, including someone you love. The first checkup I would personally reconsider after 65 is routine colonoscopy after age 75. If you are 75 or older, have no symptoms, no blood in your stool, no family history of colon cancer, and your previous scopes have been clean, the United States Preventive Services Task Force explicitly recommends against routine colonoscopy screening. Not hesitantly, explicitly. Bowel perforation, a literal tear in your colon, occurs in approximately 1 in every 500 procedures. In a 55-year-old, that is a manageable complication. A 78-year-old, that can mean emergency surgery, a permanent colostomy, and a recovery that rewrites the rest of your life. The colon cancers, most commonly found in asymptomatic older adults, tend to grow so slowly that many would never cause harm in a person's remaining lifetime. Ask your doctor instead about non-invasive stool-based tests, the Cologuard or the annual IFIT test. Same detection capability. None of the procedural risk. This was not Emmanuel's test, but it is where his story could have started, and where many exactly like his do. Now stay close. Because this next one is the point where most people push back, and where the research is most unambiguous. The second checkup I would reconsider is aggressive cancer screening in asymptomatic patients over 75, specifically routine PSA testing and routine mammography for average risk patients with no symptoms. Here is the sentence that should unsettle every person watching this. You can go through cancer treatment, lose your hair, lose your energy, lose months of your life for a cancer that was never going to kill you. Most people assume that finding cancer early is always better, and in younger bodies, that is often true. But after 75, imaging technology is so sensitive, it can detect cancers that are biologically barely awake, tiny, slow-growing tumors that left entirely alone would never spread, never cause a symptom, never shorten your life. You would die with them, not from them. But the moment a report contains the word malignancy, the clinical machine does not pause. It moves forward. Studies published in the New England Journal of Medicine found that a substantial portion of cancers detected through mammography in women over 70 were clinically insignificant. Treatment offered no survival benefit, only side effects. Before you agree to screening, ask your doctor, if we find something, what would treatment actually look like at my age, and would it genuinely improve my life? Emmanuel had this test. The finding was the kind the literature describes as clinically insignificant in the majority of cases at his age. But the report did not say clinically insignificant. The report said malignancy, and the machine moved forward. What comes next stopped me in my tracks the first time I saw the data. And I have been practicing medicine for over 20 years. The third checkup I would reconsider is routine cardiac stress testing without symptoms. Most people think a stress test is one of the safest things a doctor can order. It is not. And Emmanuel's doctor ordered one too. The results came back, flagged, his heart was fine. But the machine did not know that. Here is what that treadmill can set in motion. Cardiac tests in people without symptoms carry false positive rates that can reach 40% or higher in certain populations. Nearly half the time, the test flags an abnormality when your heart is completely fine. But medicine cannot shrug at an abnormal result. That false alarm sends you to cardiac catheterization, a tube threaded through your blood vessels directly into your heart, carrying real risks of bleeding, arrhythmia, vessel damage, and in rare cases, triggering the very heart attack or stroke you were testing to prevent. The landmark ischemia trial found that stenting in patients with stable coronary artery disease did not reduce heart attacks or extend life compared to medication and lifestyle management alone. You can go from feeling completely well to a false alarm, to a catheterization, to a stent, to a lifetime of blood thinners, and be statistically no better protected than if you had simply walked 30 minutes a day and managed your blood pressure. If you have no chest pain, no unexplained breathlessness, no dizziness during activity. Ask your doctor to help you optimize your risk factors. Instead of chasing findings your body may not need anyone to fix. So now I need you to hear the next one carefully. Because the harm here does not announce itself. It builds quietly, over years, while you believe you are protected. The fourth checkup I would reconsider is routine DEXA bone density screening followed by automatic long-term medication, without a fall prevention conversation first. The cruelest part of this one is that the medication prescribed to protect your bones may quietly be setting you up for the worst fracture of your life. Long-term bisphosphonate use has been linked to atypical femoral fractures, spontaneous stress fractures in the thigh bone, the very bone you are medicating to protect, and to osteonecrosis of the jaw, a painful, difficult-to-treat deterioration that most patients taking these medications have never been warned about. Meanwhile, the single, most evidence-backed intervention for preventing fractures in older adults is not a pill. It is fall prevention. Tai Chi alone has been shown in clinical research to reduce fall risk by nearly 50%. Balance training, removing trip hazards, adequate vitamin D and protein. These reduce fracture risk meaningfully with zero side effects. For any medication conversation, ask your doctor. Can we first review my fall risk factors and compare a structured prevention program against what this medication actually delivers? Emmanuel was placed on a bone medication after his DEXA. He was never told about the fracture risk. He was never offered a fall prevention program. He was handed a prescription and sent home, believing he was now protected. And now the fifth checkup. This is the one almost nobody is talking about. And based on 2 decades of watching what happens to patients who never had this information, it is the one that concerns me the most. The fifth checkup I would reconsider is asymptomatic carotid artery ultrasound screening. What I am about to tell you is documented in the medical literature and almost never discussed in an exam room. The surgery used to treat a carotid blockage carries a 2 to 3% risk of causing a stroke during or immediately after the procedure itself, not preventing a stroke causing one. The United States Preventive Services Task Force explicitly recommends against routine carotid screening in asymptomatic adults, because in patients with no symptoms, the risk of surgical harm outweighs the benefit. Many people over 65 have some degree of narrowing in their carotid arteries, stable, silent, sitting there for years causing no harm. But when a routine screen finds it, a well-meaning surgeon recommends fixing it. In the procedure to fix a blockage that was never causing harm, can dislodge a fragment of plaque that travels directly to the brain. This was Emmanuel's final test. The blockage they found had likely been there for years, stable, silent. His surgeon recommended clearing it. The procedure dislodged a small piece of plaque. Emmanuel had a stroke on the table. He survived. But the man who walked 2 miles every morning and tended his garden on weekends did not come home the same. He walked into that appointment feeling better than he had in years. He never asked, if you find something, what would we actually do, and would doing it genuinely improve my life? Nobody told him he could ask that. So I am telling you now. Before I give you the 5-second shield, the complete version, I need to ask you something directly. If you have a parent over 70 who sees a doctor regularly, type parent in the comments right now. Because the next 2 minutes of this video are for them as much as they are for you. And if you yourself are over 65 and you have had any of these tests without this conversation, type my turn. I read every comment on this channel, and what you tell me shapes exactly what I cover next. See, after 20 years of watching what happens to patients who went into appointments without this information, and after watching what changed when they finally had it, I developed what I call the 5-second shield. I promised you the second half. Here it is. The complete question is this. If this test finds something, what would we actually do about it? And would doing something genuinely improve my life at my age? That is it. 15 words, 5 seconds to ask, a lifetime of protection in the asking. So what it does is move the conversation from findings to outcomes. It forces your doctor to think about you, your age, your body, your goals, rather than a checklist. It creates the pause. The 15-minute appointment was never designed to create. Any good physician will welcome it. And if your doctor dismisses it or makes you feel difficult for asking, that is important information about whether that doctor is the right fit for you. Write it down. Put it in your phone. Bring it to every appointment for the rest of your life. The Emmanuel never had it, you do now. Here is what I want you to do starting today. Write down every routine screening your doctor has recommended in the last 2 years. For each one, ask yourself, was there a symptom that prompted this, or was it routine? That distinction matters enormously. Bring the 5-second shield to every appointment where a new test is being recommended. Ask it calmly. Ask it confidently. You are not being difficult. You are being an informed patient. If you are 75 or older, with no symptoms and clean previous results, have a specific conversation with your doctor about whether routine colonoscopy still serves you. For heart health, bone health, and stroke prevention, ask your doctor to build a lifestyle-based protection plan first. Blood pressure management, daily movement, balance training, nutrition. These are not soft alternatives to medicine. In many cases, the research shows they outperform procedural medicine with none of the risk. And if you ever have symptoms, blood in your stool, chest pain, sudden neurological changes, unexplained bone pain, do not wait. Do not use anything I have said today as a reason to avoid evaluation. Symptoms change the equation completely. See your doctor immediately. Let me bring this home. Routine colonoscopy after 75 in asymptomatic patients. Procedural risks that outweigh the benefits. Ask about stool-based alternatives. Aggressive cancer screening after 75 in average risk patients. Overdiagnosis leads to treatment that may offer no survival benefit, only harm. So, ask what treatment would actually look like before agreeing. Routine cardiac stress testing without symptoms. False positive rates so high they launch patients into dangerous procedures. The evidence shows may not help. Optimize your risk factors instead. Automatic bone medication after DEXA without a fall prevention conversation may expose you to the very fractures you are trying to prevent. Ask about prevention first. Routine carotid artery screening in asymptomatic patients, explicitly not recommended, because fixing a stable silent blockage can be more dangerous than leaving it alone. You stayed through every word of this video. Most people your age will scroll past information like this without a second thought. You did not. That choice, to show up for your own health, to ask harder questions, to refuse to be a passive passenger in your own medical care, that is not a small thing. That is the thing. Think of one person in your life over 65 who sees a doctor regularly. Send them this video today, not as a warning, as a gift, because the 5-second shield belongs to them too. Subscribe and turn on notifications. This community is built on truth, and I want you here every week. Now leave me this in the comment. The next time your doctor recommends a routine test, will you ask the 5-second shield question? Say yes, because saying it out loud is the first step to actually doing it. Your body has been working for you every single minute of your life without asking for anything in return. The least you can do is give it the truth. I am Dr. Clifford Adeshina, and I will see you in the next one. Everything I have shared today is general medical information based on published research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider before making any changes to your medication, diet, supplements, or health routine.